Okay, so good morning po ma'am. Now po I will be going to demonstrate on how po to assess the male genitalia and also din po the rectum. So first po thing to do is to gather po the equipment. So we have the gloves po, the pen light, the stool, and the gown po. So next naman po natin is proceed na po tayo to the patient to explain po the procedure. Okay, so good morning po sir. I am Leonard Pilansan. I will be your nurse today for today. May I know your name po? Okay, how about for your date of birth? Okay. So now po sir, I will be going to assess for your genitalia and also your rectum, which is very necessary po to know if you have abnormalities po ba to this part of your body or there have no presence naman po of the abnormalities. So I will be going to touch po your penis and scrotum part and also din po the rectum part. So it is okay po ba yan sa inyo? Okay. So okay naman po. Next naman po natin is to hand hygiene and provide for the client privacy by closing the curtain. So after po that is ask na po the patient to put po a gown. So assume po that the patient wear na po a gown. So okay, so proceed na po tayo to the first part po of the physical examination, which is sa panis po muna tayo. So sa panis po, which dapat we should the patient po should stand and the nurse po should sit po for the eye level lang po of the penis. Okay, so okay. So first po is to inspect po the base po of the penis and also din po the pubic hair growth po pattern. So okay, I will go to inspect. Okay, so no excoriation naman po, no erythema, and also din po, no sign of infestation. Next naman po natin is to inspect po the skin po of the shaft po. Okay. Okay, so no rashes naman po, no lesions din po, and lumps. So next naman po natin is to palpate na po for the shaft po, for the hardened area and area of tenderness. So I will be going to wear po of gloves. Okay, so next po natin is to palpate na po the foreskin po or the shaft po, the shaft for the hardened area and area of tenderness. Okay. So okay naman po. Next naman po natin is to inspect na po the foreskin. Okay, so but for the color, integrity, and also din po for the location. But the patient po is circumcised naman po. So let's proceed na po to inspection po of glands po. So sa glands po, we should inspect po for the size, shape, and lesion, and the redness po. And also din po the location po of the urinary hiatus of the glands po. Okay. Please. So, normal naman po. Next naman po natin is to palpate na po natin for um, uh, the urethral discharge. So, I will be going to use po my index finger and the thumb for squeezing po the urethral discharge. Okay. Okay. So, no discharge naman pong nangyari. So, normal naman po. Next naman po natin is proceed na po tayo sa scrotum. So sa scrotum po, first po is to inspect po the scrotum for the size, shape, and position. Okay? So, okay naman po yung size, yung shape po is okay naman po. And also din po yung position. So, also observe din po natin for swelling and lumps po and the bulges. Okay, so while the client is holding po his penis po upward, okay. Okay, so next naman po natin is inspect din po natin the skin po of the scrotum po for the color, integrity, and presence po of the lesion or rashes. Okay, so I will be going to inspect. Okay, inspect while the penis po is holding po um, while the patient is holding po his penis. Okay, so okay naman po. No rashes naman po, no lesions naman po. Next naman po natin is palpate na rin po tayo for the scrotal contents. So dito po we should palpate po for this size, shape, consistency, and presence po of tenderness and nodules. So I will go to palpate. So I will be going to use po my thumb and the first two finger po palpate. Okay, palpate. Go to the other side. Okay. So, okay naman po siya. Okay naman po yung size, shape, and also din po the consistency, which is no tenderness naman po and nodules. Next naman po natin is um, inspect din po natin the each spermatic cord and Van's deferens for swelling, nodules, and tenderness. Okay. Okay. So, okay naman po. Okay naman po, no swelling naman po, nodules, and tenderness. Next naman po natin is proceed na po tayo to the trans-illuminate of these scrotal contents. But we have no noted naman po of any mass or swelling po sa kanyang scrotum part. So, let's proceed na po to the inguinal hernia or inguinal area and femoral hernia. So, first po is to inspect po the inguinal hernia and femoral hernia, observing po for bulges when the client po is bearing down. So can you bear down po, sir? Okay. Okay, so no bulges naman po. Next naman po natin is to inspect na din po natin the inguinal area po. So, by observing po the bulges and masses. So, have the client po to shift a weight po to the left to palpate po for the right inguinal canal. And then, use po of placing po the index finger to the right scrotum, then pushing upward po to slit like the opening po of external inguinal um, ring. And then, have the client po to bear down or cough po. So can you bear down po, sir? Or cough? Okay. So okay, no bulges naman po and masses. Next naman po natin is repeat lang po natin to the other side and repeat lang po yung direction. Okay, so I will go yes, okay. Push and up. So can you cough po, sir? Can you bear down? Okay, so okay naman po, no bulges din po and masses. So normal naman po. Next naman po natin is proceed na po tayo to palpate po for femoral hernia. So I will go in front po of the type po um, of the femoral uh, of the femoral canal area. Okay, so going to palpate po while the client po is bearing down or cough po. So can you cough po, sir? Or bear down. Okay. Okay. Then repeat lang po the other side. So can you bear down po, sir? Or cough po? Can you cough? Okay. Okay. So no bulges din po and masses. So normal naman po. Next naman po natin is to palpate po for scrotum hernia or scrotal hernia. So, but we have masses naman po sa kanyang noted. We have no masses naman po noted sa kanyang scrotum part. So, proceed na po tayo to the anus and perianal area. So, first po is to inspect po the the anus and also the perianal area for the lesion, ulcers, lumps, rashes, and redness. Okay, so I will be going using po the seams position. Okay. So, okay naman po, normal naman po. Next naman po natin is to inspect po din the sacrococcygeal area for swelling po, for redness, and also din po dimpling. And also din po for the presence po of hair in pilonidal area. Okay. Okay, so okay naman din po. Next naman po natin is to inspect din po the rectal prolapse with Valsabam and Weaver. Okay. So can you bear down po, sir? Okay, or squeeze. Okay, so no lesion naman po or discharge. So okay naman po. Next naman po natin is palpate na din po natin for the anal sphincter tone for tenderness, nodules, and hardness. So I will be going to put po my index finger here and relax. Okay. Okay, so normal din po. Next naman po natin is proceed na po tayo to the rectum and um, prostate po. So first po is to palpate po the rectal mucosa po. Okay, for the tenderness, irregularities, nodules, and hardness. So I will be going to clockwise and counterclockwise. I'm going to insert my finger. Okay, then this. Okay, okay naman po. So, okay naman po. Normal naman po. Next naman po natin is to inspect po for uh, perianal, for the peritoneal cavity. So, I will be going to inspect po for tenderness and nodules po. Or for rectal shelf po. Okay, okay. Okay, so okay din po, no? Yung kanyang peritoneal cavity. So next naman po natin is proceed na po tayo to the prostate gland naman po, which is to palpate po for the size, shape, texture, tenderness, and also irregularities. So it is fully counterclockwise po. Okay, insert into my finger. Okay. Okay, so okay naman po yung kanyang prostate gland. Normal naman po. Next naman po natin is to inspect na po for phases of blood po and perform occult blood test. Okay? So after po removing the finger or the finger, so no blood naman po sa gloves po, so which is normal naman po dahil no presence naman po of blood. So okay naman po, that's all po for the assessment po of male genitalia and also din po for the rectum and parts. So okay, thank you po sir for your cooperation. So that's all po. All information lang po that I've gathered. We will proceed po direct po to the doctor. So after po that ma'am is analysis na po of data which is formulating po of nursing diagnosis, formulating po of collaborative problems, and also din po make necessary referrals. So that's all po ma'am for the demonstration po for the male genitalia and rectum. Thank you po.